I'm Kpoi-ete and I'm a blogger. Today we are at the Ghana Institute of Clinical Genetics right here at Kpone with a little donations to the sickle cell patient, and we also came to celebrate them during since it's a Christmas festive. So I'm here with Dr. Ivy for her to share some few highlights on sickle cell. Can you please tell us what sickle cell is? Because a lot of people may not know what sickle cell is or may have heard. They might think it's a dangerous disease that kills people very fast. So can you tell us?
So sickle cell is an inherited blood disease, and inherited means that you get it from your parents. It's not something that can be transmitted. Maybe by talking to him, I can't give him sickle cell. By touching him, I can't give him sickle cell. Now it's a blood disorder, so it means the disease is found in your blood. In your blood, there are different cells. One of these cells is called the red blood cell, and in sickle cell, that cell has a problem. So it's not shaped normally like every other cell. So under certain conditions, stress, infections, any condition where there is low oxygen, that cell becomes what we call a sickle shape or banana shape or a crescent moon shape, and that leads to various complications. The number one of which we know is pain. So you hear people living with sickle cell say they have crisis. Most of the time what they are describing is just like a pain episode that they have. But then because blood goes everywhere in your body, you can have other complications. So from your brain all the way to your feet, you can have strokes, they can have problems with their kidneys, their liver, their heart, their lungs. Any part of your body where blood goes, you can have a complication because of this.
People think when the patient is suffering from sickle cell, the person may not live long. There is a cliche that sickle cell cannot live up to a certain number of years. Is it true?
Then it was true. Now, not before,
okay.
But now not so much because there are certain interventions that have been put in place. So, for example, there's what we call newborn screening. So as soon as a baby is born, the baby is screened for sickle cell disease, and if you find out that you have sickle cell disease, we start interventions early. You are registered as a clinic, you are given some supplements, folic acid, zinc, penicillin, all those things to help you grow. We also sort of screen. Remember I talked about the fact that you can have complications every day. So we sort of screen for those. Maybe when it comes to the clinic, we test your kidneys to see if there's a problem, your liver, we go and check your eyes if you have a problem. All those things help. And then there are medications too that have been introduced to sort of help prevent the crisis. So hydroxyurea in Ghana, in other countries there are other medications. So now we have people living with sickle cell disease who live to like very old years. Here in the clinic, I think our oldest patient is over 90 years old. So it is no longer, yes, like it used to be that before you turn 18, even before you turn 5, majority of people who live with sickle cell disease die. But now we are seeing that like an increase in life expectancy. So now it's almost like you have a chronic condition, like somebody who has hypertension, diabetes.
It can be managed.
Yes, it can be managed.
Okay. So somebody may ask, how can someone get sickle cell? Because since it is not, it is not transferred through physical, touch and other things, how can a patient, or how can one get the sickle cell disease?
So it's an inherited disease. So your parents either have to be both carriers.
Okay.
So we have in Ghana about 1 in 4 people are carriers of sickle cell. So we call them people have AS. They either traits or they are carriers. So if 2 people who are AS decide that they want to have a child, for every pregnancy there's a 1 in 4 chance that you have a child who has sickle cell disease. If somebody who has sickle cell disease decides to have a child with somebody who is AS, now there's like a 75% chance that you have a child who has sickle cell disease. If 2 people who are SS decide they want to have a child, there's 100% chance. This also goes for somebody who is AC or somebody who is SC. As long as there's another hemoglobin that is not S and an S, and then somebody who is AS, then there's a chance that you can have a child who has it. So it's all from like genetics. It is not acquired. It's
through sexual means or
no. It's also by infancy. Whoever has sickle cell disease has it. It's not something that even if maybe you grew up and you found out, it doesn't mean that it was in your old age that you had. It means you had it from infancy, but it was never diagnosed.
Okay, here at the hospital, I know you have a lot of challenges, especially with what are some of the challenges you can say have been some of the things that if you should get, or probably if you should get, would help facilitate this clinic and probably would want to reach out to people out there to support?
We need a lot of things. We need a lot of things.
Okay.
First, we need, so with the patients, their major concern always is that we don't run, so we close by 3, 4, 5, we are done. Yes, we don't run on weekends, we don't run on holidays. So this long holiday that the 25th, 26th, we are running. So then if maybe somebody has to go to they have to go to any like or some of them will wait and then come. But we don't run that because we don't have the infrastructure to run it. You've seen our wards, you've seen that we have a limited number of beds, you've seen the staff, we are not a lot. So the number one thing is to get like a dedicated center for sickness in Ghana. That's the number one thing. But besides that, some of the medications that the patients are on, one majority, like 90+% of our patients are on national health insurance. So if the drug is not on insurance, they won't be able to afford it. Yes, so for those ones, even the labs that once maybe their insurance dies or they don't have insurance, it means they are not able to run it. So a lot of it is like funds for them to be able to run it. Yes, and then some of the equipment that we need. So there's we need for the lab, there's a test that can test the actual amount of tests that you have. So if you say